Hey everyone, welcome to the Canine Culture Podcast, where we talk about everything dog. Q&As with veterinarian professionals, rescue operators, everyday topics. We cover everything dog on this podcast. So make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media on both Instagram and Facebook. Thanks again for listening. Now here's that next episode. Hey everyone, welcome to the Canine Culture Podcast. This is your host, Brittany, and today we are joined by two vets from Allied Veterinary Specialists, Dr. Aragon and Dr. Mackenzie. I hope I pronounced those correctly. Thank you both for joining.
Yeah, thank you for having us.
So I want to hear a little bit about both of you. It's always exciting to hear how vets got into vet med. Whenever I was in school, I always said I wanted to be a vet. And then when I got to high school, they said, well, you'd have to give animals shots. And I said, oh, no, I don't. I actually don't think that's going to work for me. So then I went to law school, regretfully, and I should have went to vet school. So tell me how you guys both got into vet med, and if you have any specialties, and what's your favorite thing to do in veterinary medicine?
That's great. Yeah. My name is Carlos Aragon. I'm one of the owners of AVS and one of the surgeons. Veterinary medicine was always a love of mine from a very young age. I remember my mom taking me to the vet with her animals and kind of imprinting me as this seems like a cool job or something you would probably enjoy. And I vividly remember that as young as 6 years old, actually. So that vet gave me a tour of the hospital multiple times every time I visited, and helped me kind of imprint me as far as my interests. And so we dove right in, and it was a wild tour. I got into vet school when I was 19, and 13 years later of schooling, became a board certified surgeon. So it was a long track, but
That's awesome.
I'm Brad Mackenzie. I'm the other owner of Allied Veterinary Specialist, also a boarded surgeon. I got started in veterinary medicine a little bit later than Carlos. I lived with my brother, who was actually in vet school while I was in undergrad. And then I lived with him and two other guys that were also in vet school, and kind of sparked my interest. Initially started as pre-med, then realized human medicine wasn't for me, and started volunteering at one of the practices in town. Fell in love with it, and then just like Carlos, 13 years later, a boarded surgeon, and loving every minute of it.
Great. So AVS has 3 locations. Is that correct?
that's right. Yep.
Yes.
We have one in Daytona, one in Orange Park, and one in E-Town that's about to open.
Okay. And so for anyone listening, that would span from Jacksonville, Florida, of course, down to Daytona. And what are you guys a 24/7 clinic, or what are the hours? Because I know a lot of people always have that question whenever they're looking for emergency care.
Yes, we're a 24/7 facility in Orange Park. We will be here in E-Town, as well as in Daytona as 24/7. So in Daytona, we're surgery and emergency. In Orange Park right now, we're surgery and emergency, but we share our space with an ophthalmologist and a dermatologist. And then the growth of E-Town will encompass surgery, 24-hour emergency critical care, and internal medicine, oncology, ophthalmology, dermatology in the long term. So
Wow. Okay. That spans so many practices that we definitely need in Jacksonville. I feel like right now we're pretty limited. One of my dogs had an orthopedic surgeon, and I had 2 to 3 choices at the time. This was 2 years ago. And there were really 2 or 3 kind of choices. And outside of that, it was, go to Gainesville, go to another, larger city, or a city with like a veterinary school. And so I'm excited for you guys to be bringing some of that here, because it's definitely needed. And you guys will be a great referral source for anyone that needs it.
Yeah, thank you so much. We're excited. We're going to be one of the few private practices that are locally owned. A lot of the other options are going to be corporate. So we're super excited to be able to offer that service.
Yeah, so let's talk a little bit. I want to talk a little bit about the practice first. So we've got the ER side, which we're going to dive into in a second.
Yep.
And then we've also got that surgical side. And so are there certain surgeries that you specialize in, or would you say it's pretty encompassing of different surgeries? And kind of to lead off of that, do most of the surgeries stem from an emergency case, or can someone come to you just solely for surgical purposes?
So both, all the above. We perform almost every surgery under the book. As a veterinary surgeon, you're trained in doing pretty much every surgery. There's a handful of ones we don't do, like brain tumors and things like that neurologists will do, but we do pretty much everything else from the emergency side and the referral specialty side as well.
So our day could encompass doing orthopedic surgery and go from a knee surgery into removing a lung lobe and then going into the abdomen and taking out the spleen. So for he and I, we do all surgery. We just don't do orthopedics or soft tissue. We do orthopedic, soft tissue, and neurosurgery.
Awesome.
Yeah, it's a great day because you can have a day that's all knees, or you can have a day where, you're doing a herniated disc surgery or a fracture or lung tumor or skin cancer, taking out the liver for a tumor. So every day is different and exciting.
Yeah, keeps it exciting. So let's talk about the ER a little bit. So what are the most common reasons you see dogs come into the ER? And you can keep it to like the top 3 reasons you see dogs at an ER visit.
I would say vomiting or not eating is probably the number one reason they come into the clinic. I would say the emergency ear infection or skin issues. And then, lethargic, just ADR. The dog's not eating or just doesn't seem to be himself, and the owners are concerned, and their veterinarian's not available, and it's the weekend or after hours. Probably the biggest things we see them for.
Yeah.
And whenever, sorry, go ahead.
Yeah, sorry. Dog attacks. So we call them big dog, little dogs, where dogs attack each other and bite each other, create wounds, and then hit by cars, trauma and fractures, those types of things. Those are pretty common as well.
And now as we're getting into the summer, snake bites, especially in Jacksonville. A lot of pygmy rattlers and moccasins.
And overexposure to heat, too. That's a big one. A lot of people will walk their dog in 102-degree temperature, and dogs come in, at 107 degrees. So that's a big thing to educate people on, that we're big on, making sure you keep those dogs in a nice, cool, enclosed space during the heat.
Yeah, the heat exposure one, I've already heard of 2 different people talking about it. One was a sporting dog, and the other was just like a dog on a walk. And I want to say it was like a Frenchie, one of the dogs with the, the shorter snout, having some more breathing issues. And those are the ones we usually
I was actually going to say, with Frenchies becoming more and more popular, the brachycephalic dogs, the Frenchies, the bulldogs, they're not meant to be running around in 95-degree heat in the middle of summer.
Right.
They overheat quickly. And then the dogs that are in the cars, and the owners are, I put the window down. Well, even with the window down, the temperatures will still skyrocket to over 100 degrees in the car because dogs pant so much to release the heat, but then they will just increase the temperature in the car.
Whenever people are coming into the ER, and this is something that I've always done this, and I don't know what your advice is on this. I normally will call. I'll call and say, hey, this is what I'm seeing, or this is what I'm experiencing. In the past, maybe it's been like a cough that was indicating like that might be cardiac, that might be not respiratory, or something to that extent. But I always like to call in advance. Is that something that you would normally suggest before people come into the ER?
Very helpful. Yeah, very, very helpful. It allows the team to get ready, because these hospitals are 24 hours, so they're seeing a lot of emergencies all the time. So the more heads up we can get, the better, for sure. So please advise those that are listening. That's a big deal.
Yeah. And when people arrive, so I know some people are maybe a newer pet owner, or maybe they've had the good fortune of not having to come to the ER. Walk us through kind of how that works once they arrive, and then what's the process as far as like triaging and then moving forward from there?
So kind of depends on the status of the patient when they arrive. Most of the patients, when they come in, the receptionists are trained to ask some initial questions to know, okay, we need to have that pet brought straight to the back. We triage, we looked by the doctor. They're stable. They can go back to the owner while the owner's filling out the paperwork. But if a patient comes in obtunded or laterally recumbent, they're rushed right in the back, and advanced, CPR or therapy is begun right away. So, but if they're coming in for an itchy skin or something like that, usually they'll stay with the clients. It all depends on the status of the patient. But again, the technicians and the receptionists are trained to know what needs to be triaged right away.
Right. Just as if like you or I went to the hospital, if we come in short of breath, we're turning colors, or we're like, hey, my heart rate's 220. My O2 is at 80. They're like, oh, we should probably rush this a little bit, right? So kind of the same thing with how you guys train your staff.
Yes. Yeah, we have a little triage code system from green, yellow, red, blue. And so the team knows the code colors and the urgency of that. And so clients are notified immediately. And it can be stressful sometimes. A lot of clients come in crying. They witness their dog get hit by a car, or, it's bladder recumbent, barely breathing. We're highly trained on triaging those patients, but also getting the client in the room to help them, kind of cope with the situation and get rolling with the plan.
Right. Yeah. And with respect to diagnostics, I think a lot of people have this misconception that when they go to the ER, you're just going to run every diagnostic. You're going to do every blood work, every x-ray. And I think you guys can speak to that. That's not true. You're only going to do really what's needed, right? Like whatever we think is needed at that time. Generally, and I know it's hard to generalize diagnostics because there's so many different cases, but what are some of those general diagnostics that you run in an emergency situation?
So ultimately it comes down to the doctor and the assessment of the patient. So once they assess the patient, they figure out what tests need to be performed to identify the disease process so that they can educate the client on the game plan, not only for treatment, but for outcome as well. What are the percentage of outcome? So our goal is to be the patient's advocate, educate the client on what the pet needs for the quality of life reasons. We're all about quality of life, not quantity when it comes to pets. And so once the doctor educates that to the client and says, okay, here's gold standard, here's what we recommend to help your pet get back, find out what's happening and or treat, then that's presented to the client as far as the game plan and the estimate. And then the client is in charge of deciding what they want to do. And so our goal is to offer gold standard, what the pet needs, and then the client picks what they want to do based on, what they've done in the past or, those types of things. But it's our job to really, be the pet's advocate.
Mm-hmm. I feel like that can be difficult sometimes in an emergency situation because you're trying to attend to the pet, but then obviously it's the pet owner paying the bill, having to deal with the repercussions of that. And so I feel like that could be hard to balance, right? Because you're trying to do both, like the right thing by both of them. And so I'm sure that gets tricky for both of you, or for anyone in your practice. And what would you say? I mean, if someone's listening to this and they are thinking like, oh, last time I went to the ER, they wanted to do $1,000 worth of testing. What would your response be to someone that said something like that?
Well, again, every patient is different. And so you have to prioritize what you think is absolutely necessary and also what the owners can afford and what's in the best interest of that patient. And so how do we treat this patient, give them the best care for a certain budget that the owner has, and that we're doing the best thing for the patient. And a lot of the ER is, okay, we can treat your pet with this, get them through the evening so you can get back to your veterinarian, the next day. And so that's kind of the job of the emergency service, is to supply that standard of care so we can get them back to their veterinarian. Now, there's certain cases that come in that are severely sick or they need long-term hospitalization, additional diagnostics. And so if owners are willing, then we'll get into that. But I think a lot of it for the ER is treat the patient the best we can with what the owner's limits are, and then try and get them back to their veterinarian the following day.
When it comes to the emergent situation, like the dog dying, we have to treat for CPR and those types of things. So the client, we do have forums where we educate the client, which is a stressful situation because they're obviously crying and very emotional. but they do have to sign consent that allows us to treat. Does that make sense? And so on that form talks about the CPR status. Do they want us to do CPR? And then also it gives the doctor an approval of a certain amount to move forward, and that just covers IV catheter, fluids, exam, just to get the shock therapy rolling. Does that make sense?
Yeah.
So, and that's a finite amount. And so once the shock therapy is done and the immediate treatment has occurred, clients typically aren't going over 500. It's a 500 or lower situation in those shock therapy cases. Again, not every.
Right. Right.
And then the veterinary meets with the client to go over, okay, here's where we are. Here's what we're seeing. This dog's bleeding out internally. Here's what we're going to need to do. Or, the stomach is twisted. It's a GDV. Here's what we need to do. Or, temperature's 108. It's heat exposure. Here's what we need to do. So, yeah, we're real conscientious at AVS about the estimate and over communicating with the client about where their charges are, because that's a big deal for us. We want people to know where they are, because everyone's on a budget,
right,
what to expect. And so that's a big thing we do with our administration team and our doctor communication.
Yeah, I think that's great. The few times, I'd like to say few, it's more than a few, the times I've been to a dog ER, I've spent anywhere from, $1,000 to $9,000. The higher range of that, I hate to say it, it was not necessarily communicated to me. It was just like, hey, we're going to do these things. And I'm like, let's do it. And then the bill came out and I was like, oh, that was the cost. Now I still would have done it anyway. Luckily, throw it on some credit cards, whatever the case might be. I was at the ER. It was sometime last summer with one of my senior dogs, and she passed in October, but she had had a stroke. And I had never seen that. I had never witnessed that. That was followed by some focal point seizures, and then maybe like 2 grand mal seizures. I hope I'm correct on all of that, but I was in there for the whole night. I was at the ER, and I remember there was a younger lady that came in, probably 20, 21. She didn't have any credit cards, and her cats had knocked off a bottle of vitamin D3 and taken all of them. And she didn't know, of course, which cat took how much, right? And maybe one just took it all, and she had no idea what to do. And I was trying to help her figure out, like, applying for a credit card and what Synchrony Bank offer care credit. And so just trying to, like, walk her through that process, because they were slammed at the hospital that night, and she had no one else to, like, call or talk to. It's like 1 a.m. And I'm just like, do this, apply for this. And so with respect to the bills, outside of care credit, are there more options now? Like, are there other credit card or like personal loans you can do?
Yeah, there are 2 others that we offer. One is called Scratchpad, and another one is called Cherry. And Cherry, they'll give you several years to pay off the debt for that treatment. So that's been very helpful. And so there's not just care credit anymore.
Good.
So it helps out a lot that we see a lot more clients choosing those other options and allowing them to treat their pets appropriately. So, but going back to where you spent $9,000 without getting the update or, the heads up, like Dr. Aragon said, if it comes in, crashing and critical, okay, we're going to do about $500 worth of initial diagnostics and treatment, but we're not going to go above and beyond that without talking to the client. So we're focused on the patient first and foremost. And once we've stabilized the patient, then a detailed estimate is given, so owners aren't, presented with sticker shock like you were, like all of a sudden, whoa.
Right.
And so, because that's not fair to the client. And so we definitely look at keeping the clients up to date on what we're looking at cost-wise, because everybody's different. So.
Right.
Yeah, the clients sign all estimates, so we don't do anything above and beyond. So we never surprise someone with a $9 grand estimate. We over communicate when it comes to money. Unfortunately, we don't want it to affect our care, but at the same time, budget, and we have to be realistic. It's a real thing. So once we get their approval of kind of where we go, and then Our client service representatives then go over the financing options, and I would tell you they're great options too. Most of them get approved, especially with Cherry. Cherry's been a really big addition to what we offer.
That's awesome. I think that's really relieving for people to hear too, because it's just one of those scenarios where if you're not prepared, which who is, the last thing you want to be thinking about is, well, do I have the money for this? Or do I need to choose between this and this? And so having more finance options, I think, is just extremely helpful for so many people.
Absolutely. And the pet insurance too, right? I mean, it's becoming more and more prevalent. There's a number of different things that are now covering the cost ahead of time versus after the fact. And so,
right.
I think it's something that people should look into to see if it's right for them. Obviously, read the fine print, but we get a fair amount of people coming to see us that do have pet insurance that help. That's sticker shock, right? I mean, because it can be it's hard to prepare for an emergency that you're not ready for, and then and there's never a good time. When it rains, it pours, right? Like we hear all the time, this is the worst time to have this problem.
Yeah, always. So being an ER in a specialty hospital where you can do different surgeries, I feel like that allows you to handle so much more. So the first two things that came to mind for me were bloat and being able to jump in and do that surgery. And then, of course, any kind of obstruction, right? Because I feel like all the time dogs come in, maybe they're posturing, nothing's happening, or they're throwing up, or their stomach is distended and they've got an obstruction. They've got a squeaky toy. They've got an ink pen, whatever it might be. So I'm sure that allows you guys to act pretty quickly since you do have multiple specialties under one roof.
It is nice. So when emergency staff, so critical care specialists and emergency doctors, they all work cohesively with the specialists. So, you have a surgeon that you can reach out to for consultation. So they'll say, here's the case, and the surgeon and the ER doc talk about what needs to happen. And so, yeah, it's great. It's really good to have that symbiotic relationship between specialty and ER. All the ER docs consult with, this case needs a surgeon, this one needs an internist, this one needs an ophthalmologist, dermatologist, oncologist. So kind of being the Mayo for animals is kind of what our goal is, so you can provide all options under one roof and all owned by the same team who has administration and medical care unified with the same vision.
With respect to surgery, let's say a patient comes in on an emergency case and they need surgery. Some surgeries I can imagine can wait. Let's say like a cruciate tear or something like that versus something like bloat that needs an immediate surgery. How does that normally pan out? I mean, do you guys try to do every surgery kind of at that time? Or is it like, okay, this can wait, come back, we'll do a full consult? Walk me through a little bit of like that surgical process when it stems from an emergency case.
Well, if it's emergency, then the emergency doctor, the criticalist, the surgeon, they'll all coordinate together what is the best process for this patient. And so if it is a GDV, those are things that you don't wait on until the following day.
Right.
Those patients, big thing is stabilizing the patient before going to surgery. And then once we have a stable patient, if it is emergent, it's a bleeding spleen, it's a GDV, it's a septic abdomen because they did eat a squeaky toy that's now perforated the bowel. Those are things that are stabilized by our criticalist and then anesthetized by our staff, and then surgery with us. The nice thing that we have is that we have teamed up with an anesthesiologist who has trained our staff for anesthesia. And we're the only group in Jacksonville that is teamed with an anesthesiologist and has their staff trained by a board certified anesthesiologist. And she is somewhat on call for us for some of these cases that need a special protocol because they have a heart murmur or something like that. They're diabetic, she consults with us and puts that protocol together. So each patient's protocol is different and put together specifically for that patient. Now, like you said, a cruciate tear or something like that, we'll schedule those out as a normal receiving day and then schedule them into surgery because they're not, something that had to be done yesterday.
Right. So Human, yeah, yeah. No, the anesthesiologist is a big deal. Dr. McCune is her name, and we actually were one of the first private practices to bring an anesthesiologist into private practice about 12 years ago. It's kind of unknown back then, and so it's set the hospital apart as far as raising that standard of care when it comes to patient safety, pain management, anxiety management. That's a big one. And so at AVS, we really focus on the patient experience, and a lot of that has to do with the anesthesiologists and the training they have given our staff and our team. And it also allows our nurses to never get complacent with their learning aptitudes. So they're always learning. There's so much to learn because they're all becoming mini anesthesiologists for the practice, which is great.
Mm-hmm. I have one dog with a heart murmur, and he needs all kinds of special protocols before he goes under. So we usually do like a full echocardiogram. I couldn't even tell you what labs we do. We do a whole workup of labs. And we would always do that like every year before his dental. He's now 16, so we've stopped our dentals. He needs it, but we have stopped our dentals. But we always had to kind of wait for different specialists to become available or like rotate through different clinics. And so I remember, I think the last time I booked an echo, gosh, I booked 4 or 5 months out. I mean, it took me quite some time to get in. And I don't remember, do you guys have like a cardiologist or the ability to do like echoes and things like that?
We do.
Yeah.
We've teamed up with a cardiologist who's going to work part-time with us. But then we also have access to a couple of internists that are mobile internists around town that will come to our hospital and do echocardiograms.
Great.
We do have that availability at our hospital.
That's awesome. So I wanted to ask, for common surgeries, what are the most common emergency surgeries? Let's say top 3 or 4.
I'd say foreign bodies. Dogs eat all kinds of stuff. Garbage.
Yeah.
That's a big one. I mean, we've seen everything. I mean, you name it. I've seen a whole knife in the middle of the esophagus. I've seen a whole baby possum in the stomach, entirely intact, in a St. Bernard that we removed from the stomach, still moving, which was pretty wild. You name it. I mean, we can go on and on and on. Dogs will eat anything.
Yeah.
Really gross stuff too. So foreign bodies, I think, has to be one of the top.
Foreign bodies probably number one. And then, you mentioned GDV. That's probably the second emergent surgery that we see.
And Dr. Mackenzie did all his research in GDVs, so he's published.
Really?
Yeah.
So, and then probably bleeding spleens, or what they call an acute abdomen, like a septic abdomen or a bleeding spleen, something like that. Those are probably the 3 major surgeries we see.
That's the silent killer. A lot of people think the pet died in the sleep, but
Yeah.
Of course, they bleed out from a ruptured mass in the liver or the spleen. They'll just bleed out and slowly get weak and pass away. So it's always, that's the tough one. You come home and your pet's passed away, and that's most commonly what occurs. Not always, but it's a very common one we see. So I think that's top 3. It's called a hemoabdomen.
What are the symptoms of that? I had a friend who's Vishla, her spleen ruptured and she got a little bit lethargic, and then she started throwing up. It was very tarry. And then by the time they made it to the ER, that was it. Like they really didn't have any time. So I'm just curious what the symptoms of that might be. I don't even know if symptoms present in such a way that allow you to get to the hospital in time.
Yeah, we actually just had a neighbor. The dog had about a 48-hour history of just not acting right, just a little lethargic, would go on the walk and would just sit down and not want to keep walking. Appetite was reduced, just more lethargy. So some things that they can look for is look at the gums, pick up the lip. If the gums are pretty pale, that's a trigger,
Mm-hmm.
Also, just in general, weakness, malaise, inappetence, bloated belly. So if the belly looks a little more distended than average, that oftentimes means that there's fluid buildup in the belly.
Mm-hmm.
But one thing that I think goes a long way, which I think is under educated in veterinary medicine, is it's a generalization, but for the average dog, anywhere from about 8 and older, just like humans get yearly screenings, we really should be doing yearly abdominal ultrasounds, chest radiographs, full blood work on patients, because that's how we can find small things and get to them quicker and earlier and potentially save the life, So the earlier the detection, the better. It's hard to convince people your pet's normal, 9-year-old dog, hey, let's go spend, $900 on tests. But I get so many questions like, Doc, how could I have found this or prevented this from happening? And really the only way to do it is preventative treatment and diagnostics, So
Right.
kind of like a human, the earlier the detection, the better the outcome, prognosis.
Yeah. I said on an episode maybe 2 years ago that I always have my senior dogs get x-rays of their chest because I had a dog that's how we ended up finding out that she had lymphoma. And the comments that I got and the messages, they're like, you're crazy. Why would I just get random x-rays? Like, people were not happy that I said that. So I'm glad you said it so people can get mad at you. But I'm like, it's not that crazy of a concept. I mean, because we can't visually see. And like you said, that's the way to catch it as early as we can, right? I mean, because there's oftentimes no other way to see that.
No, it's the best. I mean, just like a human, right? You get to a certain age, you got to get certain tests, that maybe you don't want to get.
Mm-hmm.
Very important to detect cancer early, because cancer is the number one killer of animals. So the earlier we find it, the better the prognosis. Like taking out a 3-inch liver mass is much easier than taking out an 8-inch liver mass.
Right.
Just in general. So the earlier the detection, the better. So I'd invest in that those diagnostics as the pet gets older.
And then the foreign body surgery. So anytime I've been at an ER, there's always been at least one dog there with like some foreign body, right? Or even just my dog ate a mushroom, and the vet's like, well, what color? When was it? And they're like, I don't know. I just saw it earlier. It was white. And they're like, that's not helpful.
Yep.
So do you usually try to get them to throw up with like, what is it? Hydrogen peroxide or like activated charcoal? Or are there cases where it's clear cut and you're like, we just have to do surgery?
Kind of depends on if you can get to them within 3 hours of something that they ate, you can usually make them vomit. But after that 3-hour period, things will leave the stomach. And so it depends on how quickly you identify that they ate something. And then also, what did they eat? Because if you try to get them to vomit up, like say they ate a sock, and then the sock gets caught in the esophagus, and then you've got a major problem. So it kind of depends on what they ate and when they ate it. Kind of determines do you make them vomit, and so that kind of drives what direction we go.
Yeah, and the type of foreign body, right? So if it's sharp, it's
Right.
black, like that, you want to try to minimize further damage. But yeah, we give them, hydrogen peroxide can be given at home. In the clinic, we typically are given an injection called apomorphine, it stimulates the vomit response. But yeah, for the most part, if we feel it's a safe foreign body that can be vomited up, the average transit time for the stomach and the dog is somewhere around 5 hours. So, ideally, you don't want to give it if it's in the small intestine. That's not going to work.
Right.
And then some of these foreign bodies can be scoped out as well, so you don't necessarily have to go to surgery. The veterinary can go in with a scope, go into the stomach, grab it, and remove it that way.
Yeah, so that's done by an internist. So they go in and do endoscopy, go into the stomach, and they can grab the foreign body. So some foreign bodies can be removed, but some are possible.
Yeah. And what's the recovery look like if a dog does have a foreign body surgery or bloat surgery? Because we've talked about bloat a few times. What kind of recovery is that? Are they staying at the clinic for a day, 2 days? What's it normally look like?
Kind of depends on how serious the surgery was, because with a bloat, it could be just as simple as you reposition the stomach and you tack it and you're fine. But in some bloat surgeries, based on the duration or the amount of insult, they lose viability to their stomach. They will basically throw clots to their spleen, so they'll have infarction in their spleen. So you have to take part of the stomach, you have to take part of the spleen, or you take the spleen. And also with foreign bodies, it could be as simple as making a small incision, removing something from the intestine, or the intestine has lost viability and you're taking out 1 foot to 3 feet of intestine. And so those dogs are definitely staying in the hospital a lot longer. But if it's a simple surgery, they're eating the next day, they're bright, alert, they do great. But some of these dogs are very affected, and they're in the hospital for 3-4 days. So it all depends on the status of the patient.
Yeah, the comorbidities too. Some of them have diabetes or hypothyroid, Cushing's disease, so you can get some sick ones. That's why having a board-certified criticalist on staff who runs the intensive care unit and directs the emergency care on a specialty level is great to have. But to kind of get to your recovery part, an abdominal incision, the body wall needs about 4 weeks of no high impact activity to prevent a hernia. So the skin heals in about 2 weeks in dogs, and then the body wall, the deep holding layer to prevent the intestines from coming out, that's about 4 weeks of no running, jumping, horseplay, which can be tough, right? Owners really hate restricting their dogs, and I just talked to them about tough love. You need to be the boss, and we don't want a complication to occur. Everything we're doing is to prevent a complication. So.
Right. One of my dogs had his patella surgery, and we kept him in a kennel for might have been 6 weeks. He was young. He was 2 years old, and just wanted to fly around the house. And so I kept him with his little donut, kept him in the crate, and everyone said, "That's so mean. That's so cruel." And it's not. It would be much worse if I let him go outside and jump off the deck or come jump on the bed. Yep. I'm telling you, that would be a million times worse, and then we'll be in a worse predicament than we are now.
Starting all over again, right? It just makes sense. I mean, do it right the first time. It's not being mean. It's just having tough love and doing what's right for the pet.
Because if you or I had knee surgery, we wouldn't be running around the backyard 3 days after surgery. There was one professor I had that said, try to convince the owners that take the bill and put it on the refrigerator, because if things go bad, it's going to be twice as much the second time.
Yeah.
If you keep your pet restricted. You hear owners all the time, you fix a complicated fracture, and they come in, they're like, "Oh yeah, he's running around the backyard." And I was like, "Ma'am, if you broke your leg, would you be running around the backyard, a couple days after surgery?" So,
right. So we talked a little bit about some preventative measures. You talked about seniors maybe getting different radiographs, of course, doing annual visits, getting blood work. Are there any other things you can think of that are preventable measures that people could put into place to try to prevent some of these emergencies?
Especially with the foreign bodies. I mean, there's certain things every dog's different. Some dogs don't eat anything, and other dogs eat everything, right? So the owner knowing the behavior of their pet, and also training. I think a lot of dogs are undertrained, behavior-wise. So that goes far away. But also preventing them from getting into things. Like a lot of these dogs are getting into the bathroom trash and eating things that they shouldn't.
Right.
Or I remember having a Chihuahua that ate, over a year's period, ate all the hair that collected at the shower drain. And so when we went in, it was a grapefruit-sized ball of hair, that accumulated over time. So I think prevention of them getting into things, corn cobs are terrible. Those are one of the worst ways, and people feed their dogs corn cobs. It's wild. So I think just being educated on trying to prevent them from getting that, but also being aware of the signs of the pet, that if something is going wrong, they act quick. The whole family being aware.
Mm-hmm. And then outside of traditional preventative measures, whenever someone comes into the ER, is there any advice you have for them to be better prepared to come in and speak with you? Or is there anything you see a pet owner kind of like fumbling through, or there's maybe information they don't have that would be critical to either your diagnostics or your overall treatment?
I would say if they're on any medications, making the doctor aware of what they're on, and giving your pet baby aspirin or Advil or Tylenol. Some owners would be like, "Well, he's not on any medications." Then you find out they've been giving him Advil for like three weeks straight, and because they were limping, and so there's the metabolic issues with that. So knowing what they're on, is a helpful to know, what medications are the patients on when they come in.
Yeah, I think being prepared financially, as we discussed before too, that's a lot of people aren't, so looking into insurance to be prepared, understanding, and we try to over communicate with the process here financially, but also wait times. Wait times are tough with ERs. We work really hard at that, but and then breed specific things. So like Great Danes, the big giant breeds, we can do prophylactic tacking of the stomach to prevent them twisting. So, owners being educated on the type of breed they have and the possible emergencies or surgeries that can be seen can go along. So that's a family doctor or our referral partners do a really good job at educating clients on that type of stuff. So we'll get referrals for tacking the stomach and those things. But we do try to educate them. Like a lot of we see a dozen Frenchies a week right now, and they have all kinds of problems. And so a lot of them have broken bones or some other issues, and meanwhile they can barely breathe, right? So they're high risk for anesthesia. So I'll spend a fair amount of time doing a double consult. Here's how we fix the elbow fracture, but we really need to fix the airway too. I mean, this is major. They'll say, oh yeah, my vet talked about that, but it's very important in brachycephalic dogs because if they struggle to breathe over years, increased effort over 4, 5, 6, 7 years will lead to pulmonary hypertension, and then will lead to heart failure. And so getting to them early on where you can open up their airway so they can breathe better is monumental for them, not only health-wise, but quality of life. They can now be active and breathe better, not overheat as much. And that goes for the brachycephalics, right? So the English Bulldogs, Pugs, Frenchies, Bostons, those types of dogs.
And we'll close with one piece of advice from both of you. And it can be for the pet parent, it can be as it relates to a dog, but one piece of advice, what would you guys say to a pet parent, a dog owner?
I think being prepared for an emergency, so knowing, the location, the address, always of where you are. I have people who live here, that will come to us, but then they go travel to North Carolina, and so I'll help educate them as to, if you run into an emergency because this dog is high risk, here's where you need to go, and I direct them towards the emergency centers, specialty groups. So I think being prepared for an emergency is probably a big deal because I think that's something that gets over or not thought about, because what happens is you get hit with an emergency and then your dog gets ran over and it has multiple broken bones and the dog's biting you as you're trying to get it, and you just don't know what to do. You're frantic, and so it can be stressful. But if you know the action plan, I think that can go a far way, not only in the comfort and ease of the situation, but possibly saving the pet's life too.
Right.
I guess for me, it goes back to the preventative medicine. Have your dog or cat evaluated at least once a year, because a physical exam every year. Do they have to get chest X-rays, abdominal ultrasound, and everything like that? No, but a lot of things you can pick up on physical exam alone. You're palpating the belly, you're like, this doesn't feel right, and there's a splenic mass or a liver mass that the dog's acting great, not abnormal or anything like that, but they've got a mass in their belly the size of a soccer ball, or they've got a tumor that the owners weren't aware of, or something like that on their body. And I think having those yearly exams are important. And I think a lot of people are like, oh, well, the vets are just wanting me to come in so they can make money. No, that's where you pick up most of your abnormalities is on physical exam, listening to the chest, palpating the belly. Right. One of the things is doing a rectal exam, and finding a mass on the anal gland that gone in, and then it comes in and it's the size of a tennis ball, and that surgery, is much more difficult than if they find it the size of a pea. So I do think preventative medicine is key, and I think people have kind of gotten away from that. It's like, oh, you can order your heart guard from Chewy, or you can, get your meds online, and you don't have to go into your vet. Yeah, but you're going to miss something if you're not going in yearly to have your dog or your cat evaluated by your veterinarian. So I think that's key.
Yeah, physical is critical. Because I would say 90% of dogs with cancer who have bad cancer are acting normal. A lot of owners are like, well, how did I know my dog's normal? Well, that happens, Most dogs with cancer don't show clinical signs. And so doing that exam and then leading to certain tests to help find stuff is big. Yeah, the exam.
Well, thank you both for being on. If you're in Northeast Florida, anywhere from Jacksonville down to Daytona, Allied Veterinary Specialist, you can go there for your ER care. You can go there for your specialties. I'm about to stay on with these guys a little bit to talk about a surgery that one of my dogs needs. So if anyone wants to check them out, please feel free. And thank you both.
Yeah, it was a pleasure.
Thank you.
Yeah,
pleasure.
Thank you.
Thank you for tuning in to the Canine Culture Podcast. Please make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media. If you have any recommendations, any topics that you'd like to hear, if you know of any guests that would be good for the show, or if you yourself want to be a guest, please reach out to us. Send us an email at canineculturepodcast@gmail.com or send us a direct message on social media. Thank you for listening, and please share this with any of your dog-loving friends.